practice of medicine is a lot different here than it is in the lower 48. We have a population of about 8,000 people spread out in an area about the size of the state of Indiana.
Traveling patients is a challenge.
Many of the villages may be several hundred miles from a healthcare facility where travel is only by either snow machine or dog sled or by aircraft.
Nothing is easy here as far as providing medical care in the village.
Here it's hard to fathom what it means to get on a snow machine and ride 90 miles to get in and see patients.
If the health aide was faced with a situation that he or she didn't understand, that patient was put on a plane and flown into the regional healthcare facility, and that's a very expensive proposition.
The vision of the original AFHCAN model was to create a statewide telehealth system that would serve all federal beneficiaries in Alaska. We focused on ear disease, we focused on cardiology, trauma, wound management, dermatology. We have expanded into providing teledental care. We have dental cameras out in the villages. We have vital signs, tympanometers, and other devices so that we can treat a much wider range of primary care issues. T-Consult was designed to be basically a multimedia communication tool so people could share data.
For AFHCAN, we strove to create a tool that's very user-friendly, very easy to use, very intuitive, so that the health aides wouldn't be intimidated by it.
Telemedicine has done a lot for us here.
We've always looked for a solution that worked in a challenging technology landscape where we have a mix of satellite connectivity, high bandwidth, low bandwidth, high latencies, as well as terrestrial infrastructure.
Our application has historically been a store and forward application, very asynchronous, and that's a huge benefit that video is bringing to the table, is to have that real-time communication between the two parties.
We have about 1,500 people that do telehealth, providers every year that do telehealth. On average, there are 500 new providers each year using our system. So that's a challenge because those providers are not here in Anchorage, they're out at the remote regions. So the system has to be simple and easy to use with virtually no training opportunities. It must work, and it must provide the highest quality data, audio, video, that we can obtain.
It's not like communicating over a telephone or a fax machine or writing a letter. It's real, it's personal, and it's immediate.
The one thing that really drew us to video is the fact that it simply works. It works consistently, the video is without par, and just as importantly, the desktop sharing is beyond belief.
We had, I think, 11 people connected on iPads, iPhones, Macs, PCs, people coming in over satellite. We had 5 people sharing their desktop, and we tried to make it fail, and we couldn't.
We live here on the northwest coast of Alaska, 33 miles above the Arctic Circle. So what? Man, we can deliver health care just like they do in downtown Boston, Massachusetts.
Having reliable video in the village allows us to take better care of our patients. It really is important that we provide that continuity of care. If we can keep them in the village and include their support system there, I believe that we have better outcomes.
Our providers are demanding solutions that are based on live video.
For me, to put everybody in the same screen, it's priceless.
We've proven that we've saved literally millions of dollars, and especially travel costs.
It provides better care, it saves money, it prevents the patient the inconvenience of traveling to Kotzebue. And I think it's an important aspect of medical care that we really want to be able to deliver, and deliver well.